Okay, this is really exciting. I'm really happy to hear that you guys are running these tests. We on this show, we've been calling for antibody tests for several weeks now because I think it's the only way to see the reality of what we're facing. So I want to hear all the details of what you're doing. Start with the location. This is a smaller town in Colorado. Why did you pick San Miguel County?
Well, I think that we heard, as President Trump and as your show has said, that getting people safely back to work and back to normal or their new normal and getting the economy rolling again is really our priority, right? And the idea of how do we save lives or how do we inform people with real data and real information? And as you said, the only way to really know the rate of exposure is to test and test again, right? And I think that in San Miguel County, it offered the perfect opportunity because it's a small community that doesn't have a hospital within the county. And so if we can do it here, we're showing that it's a model that could work anywhere and that's absolutely scalable and replicable and something that we could look at a national level immediately. And we're already working and looking in the hotspots around the country.
Right, and that's what's so exciting about what you're doing. We're very appreciative that you're doing this. So San Miguel County has 8,000 residents, as I understand. How many residents at this time are testing positive currently, meaning not just the antibody test, but how many have active cases of COVID-19?
So I have to leave all of the reporting around the patient results to the county because I don't have access to them. We're doing it in a blinded manner and the community, the medical and healthcare professionals are the ones that have to answer that. I'm sorry.
I understand, although disappointing for our viewers a little bit, but we get it. There's a lot of rules around medical data. Talk to us about the test itself. So your company developed this test. There are going to be questions from skeptics who wonder whether your test adequately detects the virus and how it does so. Can you tell us a little bit about that?
Yeah, absolutely. It's a highly specific IgG only serum-based ELISA diagnostic test, which means it uses blood. And unlike a lot of the tests that we've been hearing about that have variability, and that means that sometimes I guess you get false positives or negatives, right? In this instance, we've had so far with all of the testing through independent labs, 100% specificity with no false positives or negatives. So it's really about doing the work and doing the work so that we know the answers. We're extremely confident with third-party labs. Both in the state of California, 2 of them there, and then all over the world as well. We're really confident that the test is highly specific and best in class and offers us a path forward. And one of the things that we're focused on with it is that this is an ELISA test, and ELISA machines and processing machines exist in most communities. And what that means is it means that we can empower communities and start with first responders now and get those people back to work. So the people that do have exposure, like you mentioned, and that do have an immunity or some immunity to this virus can get right back on the front lines and help America get back to work.